55 is not enough.
Medicare for all.
55 is not enough.
Medicare for all.
Time for Congress to see the light. Healthcare is our human right. Time for Congress to see the light.
Healthcare is a human right.
Time for Congress to see the light.
Healthcare is a human right.
Healthcare is a right. Medicare for all. Healthcare is a right. Medicare for all. Healthcare is a right.
Medicare for all. Healthcare is a right. Medicare for all. Healthcare is a right. Medicare.
My name is Bev Rice, and I'm going to sit down in front of Schumer's building here because, of course, you can't get up. Because I want him to do Medicare for all. 55 is nice for a beginning, but if it gives into reducing the age to 55, it still doesn't cover so many people that we need to be covered.
And what do you think about the current Medicare system?
I have Medicare. I also need a supplement to take care of everything, which is, it's not for free. Nothing is for free, but it's good. I had to wait so long to become the right age to get it, and Cobra was terribly expensive. So I am deeply grateful for Medicare.
Hi, my name is Rich Marini, and I'm here to advocate for Medicare for all. Healthcare is a human right, we believe. Given that we spend millions of dollars, $720 million a day in Iraq, $250 million in Afghanistan, plus whatever this escalation is going to cost, surely we have enough money to provide healthcare to everybody in this country.
And are you going to risk arrest today?
Well, it's not really up to me if I get arrested. It's up to the police about, who they're willing to arrest and not arrest. I'm here taking a stand today. Today is the very day a company that I work for has told its employees that they will no longer cover healthcare insurance, and it's going to cost employees as much as $8,000 a year for coverage to continue their coverage. This is very much needed. We are supposedly the richest nation in the world, and we are the only industrialized nation that does not provide health care to the residents of their country, and that's just ridiculous.
My name is Dan Murphy, and I am going to risk arrest today. I'm risking arrest today because Chuck Schumer is not showing enough leadership in bringing Americans health care for all. I'm really not seeing it, and my patients aren't seeing it. And this whole health care bill that the Senate Democrats are negotiating is actually really a big handout for insurance companies and a disaster for most of my patients. And I won't stand for it.
And what do you think of his proposal to start Medicare at 55?
I think it's very weak. Medicare needs to start when you're born. It needs to start before you're born. And giving the insurance companies a huge new market and a huge new handout in exchange for lowering the age of admission to Medicare is a joke. It's a horrible joke. Medicare. Everyone needs to be covered by Medicare. Not just folks who are 55. We can do better.
My name is Luke Attar. Today I'm risking arrest. I'm trying to achieve Medicare for every member, every citizen of the United States. And it's just my personal belief that, you have to take care of people, and healthcare is a human right. And that's why I'm here. I just want everybody to have better than adequate medical coverage, the best medical coverage. And I want it extended to every member of society, whether they're rich, poor, homeless, or an undocumented immigrant. I want all those people to be covered by Medicare.
And what do you think of Schumer's proposal to start Medicare at 55?
Schumer hasn't gone far enough yet. He needs to expand Medicare to everyone, and then I'll be satisfied once every single person in the territory of the United States is covered by Medicare.
Medicare 2.0, everyone in, nobody out. Schumer has raised the possibility of lowering the age for entry to Medicare, and we want that age lowered to the instant of birth. We need cradle-to-grave coverage with Medicare for everyone. It's the only way that we can have what you need when you need it health care for every American. There is no other way. It's the highest value health care for dollar, and we need value here. We don't need for-profit health insurance companies providing low added value to our system while siphoning off money into profits, corporate salaries, dividends, and so on. And so we are here to stand up for Medicare for all and to pressure Schumer to do what's right and move that cause forward. I don't want to see any more people who I have to take care of who have bleeding in their brain because they can't afford taking care of their high blood pressure. This is a reality, and people are dying, and it shouldn't happen here in America. We can do better.
What do you think about the Medicare that Schumer proposes versus the Medicare that Conyers proposes?
He's asking me to compare and contrast Schumer proposed Medicare with Conyers proposed Medicare. And the thing is that what's been proposed, the currently proposed Medicare expansion, is really a little bit of a black box, so we don't know what's in it. And as always, the devil is in the details, so we want to try to keep the angel in the details. So I don't know. Nobody knows. But the idea of an all-inclusive entitlement plan where we don't chop up Americans by location, ethnicity, income, and give them different sorts of care is the right idea. And we need to expand on the all-inclusive entitlement program with automatic enrollment paid for with progressive taxes as the way to cover everyone in this country.
55 is not enough. Medicare for all. 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 Healthcare is a human right. 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 Medicare for all.
Why are you here today?
I'm here because I don't have health care and I'm a working individual and I need to be able to see a doctor.
And what do you think of Schumer's plan?
Schumer's plan is not enough. We need Medicare for all working Americans of all ages.
I'm here because I'm better insured under Medicare than I was under GHI in all the years I worked. Everybody should have Medicare.
Medicare, I too am on. I certainly need the supplement, indeed, to cover some of my terrible bills. It's for everybody.
My name is Luca Tarr. I'm risking arrest because I like human beings and I want them to be healthy and happy.
Woo! Woohoo!
My name is Judy. I'm 40 years old and I want government paid for health care.
My name is Rich Marini. I'm a computer programmer. My company has stopped covering health insurance costs, and they are passing the cost on to the employees. And given we are the only industrialized nation that does not provide health care, certainly we can afford it with all the money we're spending in Iraq and Afghanistan.
Yeah! Woohoo!
My name is Dan Murphy. I'm a fourth-year medical student, and I'm risking arrest because my patients aren't getting the insurance that they need, and with Chuck Schumer's plan, they're not going to get it either, and that's not okay. We can do better.
My name is Laura Boylan. I'm a neurologist. I've taken care of too many people with bleeds in their brain because they can't afford the basic care for hypertension. We can do better.
My name is Amal Jasantiliana. I'm here because my parents come from a really poor country with universal health care. And it's a shame for me to tell people there that people die in this country because they can't afford health insurance.
Healthcare is a human right. Medicare for all. Healthcare is a
I'm Lieutenant Wolf of the New York City Police Department. You're obstructing pedestrian traffic in the entrance to a private building. I'm ordering you to leave the sidewalk here. If you do so voluntarily, no charges will be filed against you. If you refuse to leave, you will be placed under arrest and charged with discard and trespass. If you do not wish to be arrested, you must leave this area by exiting towards 47th Street.
Healthcare is a human right. Medicare for all. Healthcare is a human right. Medicare for all.
Since you have refused to leave the sidewalk, I'm now ordering your arrest on the charge of disorderly conduct. If you interfere with your arrest and delay the opening of the sidewalk and the entrance, an additional charge will be made against you for obstructing governmental administration. You are further advised that the charge of obstructing governmental administration is a crime. Under the law of New York, you will be fingerprinted and subject to formal arrest processing.
Healthcare is enough. Medicare for all. 55 is not enough. 55 is not enough. Medicare for all. 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 55 is not enough. 55 is not enough.
Make a little way here if you want to get
55 is not enough. Medicare for all. 55 is not enough. Medicare for all. 55 is not enough. Medicare for all. 55 is not enough. Medicare for all.
Medicare for all!
Not enough. Medicare for all.
No, that way.
55 is not enough. Medicare for all. 55 is not enough. Medicare for all. 55 is not enough. 55 is not enough. You are heroes. You are heroes. You are heroes. 55 is not enough. 55 is not enough. Medicare for all. 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 Medicare for all. 55 is not enough. Medicare for all. 55 is not enough. Medicare for all. 55 is not enough. Medicare for all.
They're going to spend 24 hours in jail now. It's brutal, you know? Tomorrow afternoon. Hopefully tomorrow afternoon. You know? It's brutal. For speaking up for human rights. That's the thing. Speaking out that somebody can get some basic health care. They're going to spend 36 hours in jail, maybe risk their jobs. You know? I mean, significant risks. And they're going to be put through the system called criminals and have to pay their own days off, use their sick days because they're speaking out. That's what it's come to in this city. It's brutal. Brutal.